Good day and welcome to our Medicare Understanding the Basics info session. My name is Dr. Rafael Maldonado. We will review important information to help you prepare for the Medicare Open Enrollment 2020. This means that if you need to enroll, add, drop, or switch, this is the time to get ready. Do your homework and ensure you understand all your options. If at the end of this session you still have questions or concerns, feel free to call your Medicare representative or call us at Senior Services, 210-358-7477. I want to start this session by looking at some important questions you need to ask of yourself and those helping you. Who's going to help me? What am I going to get? When am I going to get this? Where am I going to get my services? What are my needs and what are my wants? Very important things to keep in mind as we go through this session. So what is Medicare? Health insurance for people 65 and older. Under 65 with certain disabilities, any age with end-stage renal disease, and is administered by the Center of Medicare and Medicaid Services. What are your choices? Several things to consider. Original Medicare, which is known as traditional. It includes Part A and Part B. Part A is hospital insurance. Part B is medical insurance. You can add Medigap, which is Medicare Supplement Insurance Policy, and we'll talk about that in detail in a couple of seconds. Part D is prescription drug coverage. Or your other option would be a Medicare Advantage plan or plans. It is and combines Part A and Part B. It may include or it may not include Part D, which has prescription drug coverage. So let's talk more in detail about Part A. And Part A is considered automatic. Automatic enrollment for Part A is automatic with no monthly premiums for those who meet the following criteria: have worked a minimum of 10 years, has paid at least 40 quarters of Medicare. What's a quarter, you may ask? For example, January, February, March is considered one quarter. Is a U.S. citizen or legal resident? Initial enrollment period is mailed 3 months before you turn 65, or 24 months with disability benefits. It includes your Medicare card. Medicare Part A, hospital insurance coverage, covers inpatient hospital stays, skilled nursing care, hospice care, limited home health care. It does not cover prescription drugs, so this is something to keep in mind. Especially if you're taking certain medications, you want to make sure you have coverage for what you need. When you enroll in Medicare, your initial enrollment period lasts 7 months. It begins 3 months before your 65th birthday. It includes the month you turn 65 and ends 3 months after you turn 65. But let's say you realize that the last time to enroll was yesterday. Can you still enroll? Yes, but you may have penalties If you missed your enrollment period, please contact your Medicare representative for assistance. If you're not sure, give us a call. We'll help you. Part A, deductible and coinsurance. So what's a deductible? It's the amount of out-of-pocket you have to pay prior to getting services. And coinsurance is the shared cost between you and the company. So cost sharing for 2020, inpatient hospital deductible is a shared cost for the first 60 days of inpatient hospital care. That would be $1,408. Daily coinsurance for the 61st first day, 90th day is of $352. Daily coinsurance for lifetime reserve days is of $704. Skilled nursing facility coinsurance is of $176. Again, I encourage you to talk to your Medicare representatives for further details. So what is Part B? And Part B is optional. It helps cover for doctor's visits, outpatient procedures, diagnostic tests, clinical labs, medical supplies, vaccines, and screenings such as mammograms, diabetes, and prostate screenings. It does not cover prescription drugs. Again, this is important to keep in mind. Paying for Part B premiums. Most have to sign up. Monthly premiums is determined by income. Premiums can be deducted from one of the following: your Social Security payments, railroad retirement payments, and federal retirement payments. If not deducted, it can be billed every 3 months. You can do this online, going through Medicare.gov, through your bank account online payment services, through the Medicare Easy Pay, or by mail using the payment coupon received with your bill. Monthly Medicare Part B premiums, if your yearly income in 2020 is one of the following: if you file individual, it's $87,000 or below, or you file joint, that could be you and your spouse, of $174,000 or below. And then you would pay $144.60. Now I added this number of $148.50 because it's a projected amount. So I encourage you to talk to your representative to make sure has the amounts changed for next year or not. For income levels of $87,001 or $109,000, or for joint of $174,001 or $218,000, you may pay $202.40. Again, if you have additional questions, we encourage you to talk to your Medicare representative. Medicare Part B deductibles for 2020 is of $198. We encourage you to look into annual wellness visits. There's zero cost for these preventive services. When you meet with your doctor, if they encourage something additional tests or services, do ask for possible additional out-of-pocket cost. Now, lately, you may have heard a lot about telehealth. Medicare can pay for office, hospital, and other visits offered through telehealth, such as e-visits or virtual check-ins. Maybe you had a doctor's visit through your phone or through your computer. This is considered telehealth. Please check and confirm with your Medicare representative about this. Medigap. This is also optional. Medigap supplemental insurance helps pay some healthcare costs that original Medicare does not cover. It's sold by private companies. It supplements original Medicare. You must have Part A and Part B. Monthly premiums may vary in cost, so you want to look into this more detail. So you'll have choices to make. Open enrollment period starts when you are 65 and enrolled in Part B. Part C is optional. This is the Medicare Advantage plans, the all-in-one plans. It includes emergency care, urgent care, drug coverage, routine vision, hearing, and dental, and that's like primary insurance plan. Health plan options, these are approved by Medicare and run by private companies. May include in-network or out-of-network doctors. So what does this mean? In-network means that the company has a list of doctors and I have to choose from that list. Out-of-network means they have a list, but if Dr. X is not in this list, I can go with Dr. X only if I have out-of-network services. Some plans may provide additional benefits, such as gym membership. So you definitely want to look into this. Annual enrollment period for this is October the 15th through December the 7th. You must be enrolled in Part A and Part B. You must pay your Part B premium and Medicare Advantage premium. Some plans have no premiums, so you want to look into this if this is one of your concerns. Some plans pay all or part of your Part B premium. Again, this is something you want to do a little bit more homework on. Some plans may or may not have deductibles. Some of you may not want to have a deductible, or you may want to have one. You want to look further into this. Co-payments or co-insurances may vary. Again, you may have to do a little bit more homework. May have a once-a-year payment. We encourage you to do shop around and ask questions. Make sure you know what you're shopping and what you're getting. Part D is optional. Part D, Medicare prescription drug coverage. The medication plans help pay for medication approved by Medicare, run by private companies, and available to everyone. You must enroll to get coverage. 2 ways to get coverage: through Medicare prescription drug plans or Medicare health plans with prescription drug coverage. It offers a standard level of coverage, may vary in cost and drug coverage, different co-payments, different deductibles, and it helps pay with medications typically not covered for Part D. So again, if you are concerned about your medication being covered, this is a good question to ask. Is my medication covered? Yes or no? Enrollment requirements. You must have Medicare Part D and or Part B. Correction, let me correct myself. Part A and or Part B to join. Medicare prescription drug plan, the Medicare Advantage plan with drug coverage. You must live in the plan service area. This is critical. Make sure you're in their service area. You must enroll when you turn 65 or become eligible for Medicare. If you do not enroll during this period, you may have penalties Again, always double check with your Medicare representative. Join or switching plans. And enrollment October the 15th through December the 7th. This is the time when you can add, drop, or switch. Medicare Advantage open enrollment period is January the 1st through March the 31st. You may disenroll and switch to different Medicare Advantage plans. Special enrollment. You must meet this criteria. Maybe you retired, you moved, you need extra help, or you have a qualifying health issue. Talk to your Medicare representative. Double check on the special enrollment period. Again, important questions to ask of yourself and those helping you. Who's going to help me? Who's going to give me my services? What am I going to get? When am I going to get my services? Where am I going to get my services? What are my needs and what are my wants? Very important questions to ask of yourself and ask of those helping you as you look into making these important decisions. This concludes our session. For additional assistance, know that we're always here at Senior Services. Our phone number again is 210-358-7477. If you still have questions or concerns, please feel free to call again your Medicare representative or call us at Senior Services. In addition, we have mailed or will be mailing you, if you have not received it yet, some information sheets. It includes a list of resources and a list of Medicare Advantage plans that are contracted through UHS. Again, if you do not receive these packages, then please call us. We'll make sure that you do get it.